Welcome to our Mary Greeley Primetime Alive program, Foot Health. I'm Vicki Newell, and I manage the Primetime Alive program here at Mary Greeley. As a reminder, if you would like more information about the Primetime Alive program, you can visit our website at mgmc.org/PTA. Our presenter today is Brent Baerenwald. Brent received his undergrad degree from Central College in Pella and his master's degree in, right, or PhD?
Master's degree.
Master's degree in physical therapy from Des Moines University. He has been a physical therapist and frequent Primetime Alive presenter for 22 years. One of Brent's areas of interest is treating feet. Please welcome Brent.
All right, thanks very much, Vicki. All right, well, I thought today we'd talk about foot health, but I wanted to talk a little bit about some of the things that we've been seeing in the clinic due to the pandemic. And the people have been kind of getting stuck at home for the last year. People have not been getting out, not been exercising. So I kind of wanted to go over some of the things that might be happening because of that. And so I thought we'd kind of start there today. I'm going to show some examples of some shoes and things that may or may not be good for you, go over some self-treatment options, and then we're going to do another little test with some water, and just so you can kind of see what your arch looks like if it interests you. This is kind of different for me talking with nobody's in the audience, so I hope you'll bear along with me however this looks. One thing that I am disappointed with today, there's no cookies, because usually when we do this in the hospital, we get cookies, so just saying, no cookies. Okay. All right, so as we know, the last 14 months, people in general have not been exercising as much. They haven't been as active. People haven't been going outside. So, things have changed with some people. Some people have put on a little weight. We've lost some physical condition. And so that's all seems to affect people in different ways. And we've been seeing lots of different things, not only some foot problems, but lots of other things as well. And we're very busy in the clinic. All right, so from a foot standpoint, we talked about not exercising and not weight gain, but people have been standing around the house a lot and, doing your household activities. And what I've been seeing and talking to people is some people are wearing some really bad shoes at home when you're just standing around doing things. So today, the first thing I'd like to do is just to show a few examples of what you might have been using. And I'm going to sit down if you don't mind, show you some examples of what people have been doing, and maybe discuss some examples of some better shoes that you might be able to use around the house. So, I hear all the time, I go barefoot at home. What's so bad about being barefoot at home? Because it's comfortable for me. It's not good for you when you're doing chores around the house, like maybe doing laundry or making dinner. It's really not great for your feet. It's no big deal if you're just watching TV, reading the newspaper, you have to go from one room to the next, but we really don't like people standing a lot at home, doing chores if you're barefoot. So some people always tell me, yeah, I wear slippers at home. So, and I had some of my coworkers bring some of these in. So this is a slipper. What's wrong with this? Well, there's not much to it. It's just, you can just roll it up like a piece of bread. So people wear this kind of stuff at home. That's no good. These little ones that you can slip on, soft, foamy, squishy little house slippers, they got a little tread on the bottom. I mean, you could use that for a hot pad or something when you're cooking, but that's no good. Same thing here, these kind of things. So people have been using these kind of things at home, just do a lot of standing in, and that's really not good for you. I'm gonna have to get these later. Ooh. All right. Now, for standing at home, just if you're in the kitchen or around the house, you're not doing a lot of walking, you're not doing a lot of exercising. Really, I'm going to hold these up so hopefully everybody can see them a little bit. Flip-flops are not bad if you're just standing around the house. They're okay for just being at home, not for walking and not for exercising. And these are fairly nice, rigid flip-flops with a nice sole on them. So these are actually okay for at home, standing around the house, doing your chores at home. So these aren't the worst things. Some people like to wear slides where you can just slide your feet into this. Once again, for around the house, just doing your chores, they're not so bad. I'll tell a lot of people, put them next to your bed so that when you wake up in the morning, you can slip your feet right down into them. They work great for that. Sometimes if you're having foot problems and foot pain, a lot of people have issues when they're standing in the shower. So, oh boy, it really hurts my feet when I stand in the shower because it's hard. So I'll tell a lot of people, hey, put on an old pair of slides or a pair of flip-flops and stand in the shower. So that can be quite helpful. Something else that works, like I'm sure a lot of you know what Crocs are, the rubber shoes that slip behind your feet. Those work pretty good for standing in the shower too. So they have their uses and their places for at home for standing around, but not for walking. All right. So just as a reminder, you don't always have to wear a good pair of shoes if you're around the house just sitting or not doing too much activity. Now, one thing that I do really recommend for people in the summer, especially, it's been really warm out the last week. Actually, it's been quite hot. That if you like to go outside and walk around, you're going to the grocery store, you're doing a few things. When people wear sandals, if you're walking and you're going somewhere, if you're going to go to the grocery store, if you're going to go out shopping, if you're going to go out to eat, or you're going anywhere, I don't like people to wear flip-flops if you're walking. So that's a no-no. People put these on and they grab with their toes, and it just really, over time, people tend to have a lot of problems. And I know people like to wear nice blingy flip-flops and everything walking around a lot, but these really are not good for walking. Same thing with these slides. Don't do a lot of walking in these. Now, what I do usually tell people, if you're having foot problems, if you're going to walk and you still want some sandals on because it's nice and warm out right now, is wear some type of sandal that has a back on it. Now, these are mine. There's an old pair of Keen sandals that I have. They're big, size 13. Wow. So these have a nice back on them. You can slip your feet down into them really easy, really comfortably, and they snug up nice and tight. So when you're walking, they stay on your feet really well. So this is the type of sandal that works pretty well for walking, going to the store, just being active in general. Okay. Here's another type. There's another pair of sandals of mine. These are some Echo sandals. These are really good sandals. They're also quite expensive, so you don't have to buy Echo sandals. But if people are going to go do a lot of walking, they like to go out to Ada Hayden and it's hot out, it's warm out, or you're going on vacation and, you know, it's nice out, you want to walk around. I always recommend that people have sandals that at least they Velcro around the back of your ankle and then around the front of your ankle. That way you can just walk normally heel toe and you're not grabbing with your toes or having to squeeze with your feet to keep those flip-flops and your slides on. So any type of sandal really you can find that for the summer that has a back on it and something that Velcros around your ankle should be okay for you because they'll just hold on your feet and you'll do a better job of walking with them. All right. In general, if you want to exercise and you're going out for a walk and for exercise and you still want to wear good shoes, for most people, now this is a pair of my shoes that I actually wear to work and if I'm going outside in, people should wear shoes that are fairly supportive as far as if I push this together a little bit, see, it doesn't bend very much right here. So if I push it, it's pretty stiff there. And if I squeeze it right here, it doesn't give very much. So this is this type of thing that you want to look for if you're doing a lot of walking for exercise, really to keep your feet supported, keep them feeling well. Nothing that's really very soft and squishy. Everybody likes to wear soft, foamy, squishy sandals, but they're really not that great for you if you're out exercising or out walking during the summer especially. So just some things to look at if the next time you go out shopping for a pair of shoes that you might be doing some walking in. I'm not particular about the brand, really. I just tell people, go get a good pair of sturdy shoes, a good brand that fits you well, and buy the most expensive shoes that you can afford to buy. So I don't tell people a specific brand because everybody's feet is different and brands fit a little differently. So I'm not too particular about the brand, actually. All right. So there's just some things about shoes, a brief review of some footwear that I like to tell people to do for the summer. When I do see patients that have some foot pain, I often want to take a look at their foot and their arch, because that and how high or how low their arch is, and that can kind of give me an idea of maybe what kind of problems that they're having. So I think in the information that people have, there's like three arch types: low, regular, and high. So today, you may not be able to do this at home right now, but there's a little test that I want you to try to do sometime if you're interested, just to kind of get an idea of what your arch looks like. And I'm going to try to do it today, and hopefully it turns out okay. So what you need to do is, through a little of experience, I've tried this several times already to get it right, you need some water. Just a little pan of water is fine. And if you have a nice wide pan, like a baking pan, that's wide so you can get both feet in there, that works a little better than the bucket I have here. But I did this several times. Regular paper seems to be, my feet stick to regular paper, so that doesn't work the best. So actually what I found that works the best for this is like cardstock. If you have any thicker or heavier paper around, cardstock works better. Also, cardboard, a piece of cardboard works really well because it's nice and stiff, and the wetness from your foot will still show up on there. So pardon me while I roll my pants up here and get ready for this. All right, now we're going to move over here a little bit. Now, I've also found that important part of this, if you dunk your feet in and you try to do both feet at a time, my feet tend to stick to the paper, so if you put both feet on there and you try to lift them up, the paper's stuck to the bottom of your feet and you can't see your arch, so that's kind of a little difficult. So here's the way that I found works the best, and hopefully you'll be able to see this on the paper that I chose a little bit. If not, maybe I'll try another piece of paper, but we'll see how it goes. So I'm just a little bit of water in the bottom of the pan. I dunk my foot in there just briefly, lift it up, get the big glops off, get the big drops off, just step right down in the middle, and I just stand up like there for a second, and then take your other foot and hold it down, because you got to pull that up, because otherwise it sticks. Oh, I don't know, that's kind of so it's not showing up very good, is it? No, okay, we'll try another piece. I tried several different kinds today. Sorry for the delay. Let's try another piece. There we go. Medium colors seem to work best. That's probably too light. All right, we'll try it again. I could see it okay, but I know on the camera you guys probably can't see it very well. All right. Let the drops come off. Stick it down. Stand up. Let it go down on there a little bit. Soak it in a little bit. Lift it up. Yeah, that's better. Now, I don't know if you'll be able to see it very well on the camera, on the presentation, but you can definitely see it at home. So you can I'm going to hold it up just like this. I don't know if you'll be able to see the darkness of it very well, but they can see it in the back of the room okay. I'm sure maybe if they're zooming in, you can see it a little bit better, but I can definitely see my arch on there. So if you go to the sheet, and they should be able to see this, right? Now, if you go to the sheet and look at my arch that I did, I would say that mine looks pretty much like a normal arch. I got a little bit of an indentation there with a clear area, and then my heel and my forefoot. So actually this works pretty well for me to see it with this paper. I'm sorry if it didn't turn out too well on the video. But at home, if you have some cardstock or something that's thicker in a medium color, seems to work about the best. Not a white piece of paper, that's a little light, you can't see it very well. So maybe try some medium paper. All right, so now that you've done the test, what does that really mean? Whether you have a low arch, a normal arch, or a high arch. First of all, if you're not having any foot problems, it doesn't mean a whole lot unless you're having some issues. They can tell you some things, but there we go. Now, if you have the low arch and you see a lot more of your foot, and I kind of looked at the map of the United States, if you take away the toes, the low foot kind of looks like the state of Indiana. I don't know, it might be close. Looks like the state of Indiana. That means that your foot has more pronation, and that says that on your handout. More of your foot is touching the ground, you have less arch, and your foot tends to pronate, or your heel tips to the inside. And that can cause problems with people who have flat feet that do a lot of standing. The normal arch, you can see in the middle part, there's usually a gap, and then the heel and the forefoot are represented. And then the high arch, when you, oh no, that looks like New Jersey. That looks like the state of New Jersey. So you look on a map, you'll find it. And the high arch looks a little bit like Florida. So the high arch is your arches tend to be really high, not much of your midfoot is hitting the ground, and people tend to have a lot of heel pain sometimes if they have a high arch because that's all that's hitting the ground a lot of times are their heels. So those are the three types. It's just a little information. I thought it might be kind of interesting to do that today. You can certainly try it at home, try some different paper, stand up. Make sure you do 1 foot at a time because like I said, you got to stand back up and have your other foot to pull your foot off the paper and just try it and see what you think and kind of use the handout just so you can kind of get an idea of maybe what your arch type might be. Okay, so what do we do with this information? Like I said, if you're not having any foot problems, it's okay. We don't need to do anything about it. But if your foot is flat, what that means is you probably need, or you have a low arch, you probably need to wear footwear, around the house most of the time to keep your foot supported and to keep your arch from collapsing anymore. Over time, people can really have a lot of trouble if their foot and their arch is really collapsing, and if there's hardly any room, if you go to stick your finger underneath your foot and you can't get it in there at all, there's hardly any room underneath your foot. People can really start to have foot problems over time with that type. So it's kind of important always to wear good footwear as much as you can. If you have a normal arch, I just tell people wear good footwear that fits you. And like I said, brand is not such a big thing. Just buy the best footwear that you can afford to buy. Make sure it fits you well. There's a lot of good shoe stores here in Ames that they do a good job of taking time, helping you out if you need to make sure you can find what fits you well. A high arch, one thing that people that have high arches, and if you don't see much of that arch touching the paper when you do your test, you really want to make sure that you avoid lots of walking and standing with flat shoes. Because if you have really flat, straight shoes that really have no arch support to them at all, that's when people really tend to have trouble if it's a really flat shoe without much support. All right. So just something I thought might be interesting for you to try. You can certainly try that at home. And if you have questions, you can let me know how that went. I don't suppose anybody's doing that right now because nobody has all their equipment at home right now or their pan of water, but you can try that sometime. Okay. Now, what can you do if you're having foot pain? What are some of the things that you can do at home without having to go into the doctor or to see somebody about it? Number one, look at your shoes. How old are they? Your shoes break down on the inside before they break down on the outside. I wear orthotics at work because I stand on a hard floor all day. Actually, I have some orthotics that I had made for me. And recently I had to get rid of a pair of shoes because the outside was still okay, but on the inside when I was standing, I could really feel my heel just bottoming out on the bottom of the shoe. I could feel it. So, a couple of years of a good shoe if you're doing a lot of walking and standing is probably enough. So remember, shoes break down on the inside a lot faster than they do on the outside. So look at your shoes and see how old they are, how much wear they have on them. Now, one thing that I also want to talk about a little bit besides shoes is some insoles. So these are some things that you can do yourself if you've been having some foot problems without having to go in and see somebody. Number one thing sometimes that if I'm treating somebody is you can buy some over-the-counter insoles that are pretty decent. They're not bad. They're not custom orthotics by any stretch of the imagination. But there's a few stores here in town. Most of the shoe stores in town will carry a few of these brands. One of the brands that I recommend that people try to buy because I think they do a good job. And actually, I have these in my shoes. They're called the Oboz, O-B-O-Z. So this is what I have inside my shoes that I wear around. It's just an off-the-shelf insole that you buy the size, like for me, size Bigfoot or size Yeti, but I trim it to fit. And you just buy like size 12, 13 or size 7, 8, and you make sure that they fit down inside your shoe, and you just trim the toe to fit. And these are Obos. I believe I got these at Jack's Outdoors, but I think some of these insoles are also like at Brown Shoe Store and Emmerhoff's and other shoe stores in town. So I like these. These are, oh, I'm sorry. Yeah, I had that written down. Thank you. Vicki asked how much that they cost. I believe these are $25 or $30. So they're not tremendously expensive. There is a little investment, but compared to, if some people can get by doing these okay, compared to $300 custom insoles, So pretty good. So I like these. I actually use these myself. Another brand that I know that they have at several stores here in town are called Superfeet insoles, and they're kind of the same thing. You buy size 7, 8, or 8, 9, and you just put them inside your shoe and you trim them to fit. And sometimes they can be helpful with people. Now, sometimes if you get a new pair of insoles in your shoes, sometimes you need to wear them for a few hours, then take them off, then wear them for a few hours again. Sometimes your foot has to break into them, so sometimes you just can't put your foot in and go. But over the course of probably a week or two, you should be able to hopefully see if they're helpful for your foot problem. So sometimes over-the-counter insoles can be a good answer initially, just to try it out. And I think the Superfeet insoles, I believe, are a little more expensive. I think they're $40. So either in the $30 to $40 range, you can get a pretty good pair of off-the-shelf insoles. Like I said, myself, I wear custom orthotics that I had a podiatrist, Dr. Sorrentino here in town. I had a podiatrist make for me. That's because I do a lot of standing all the time, and I've had some foot problems. I always recommend, I prefer people, if you're going to spend $300 or $400 on a pair of insoles, rather than go to a store that I know many people have seen commercials for, rather than go to the store that you just grab a pair of insole off the shelf and spend hundreds of dollars. If you're going to spend that much money, I always recommend people go see a podiatrist. They all do a really good job here in town, and have somebody evaluate you, see what your needs are, and they can maybe, if it's indicated, they can maybe make you a pair of custom insoles for the same price that you would buy at some of those expensive off-the-shelf ones. So to me, I think it's worth it to have somebody evaluate you, look at your feet, see if there's any other problems. So that's my suggestion anyway, if it gets to the point where you think you might need some custom-made insoles. All right, a few other things that I don't see myself, but I wanted to make sure that I passed on to everybody. I know in the last year, people haven't been going in for doctor's appointments. Nobody's been going to the podiatrist. And how many people out there used to get their toenails taken care of at the podiatrist office? Are you diabetic? Do you have maybe some wounds on your feet or some things that you've noticed that are going on with your feet over the last year that you really haven't taken care of? So that's one thing that's probably important, that if you're diabetic at all and you have any sores on your feet, things are not healing well, you really need to go in and get that looked at and taken care of. If you're having trouble with your toenails, go in and get it taken care of, because those can cause problems. So we want to make sure that you go back into the doctor. They're all open now. You still have to take some precautions, but everybody's seeing patients, so make sure you go in and get that taken care of if you need to, so it doesn't get worse. That's the main thing. We don't want it to get worse. All right, just getting there. Few more minutes here. One thing that I wanted to make sure that I pass along to everybody is now things are starting to open up. COVID is decreasing, thankfully. The numbers are going down. The testing numbers are going down. But everybody's getting ready now. A lot of people want to go travel. They want to go on vacation. They want to go visit people. Let's make sure that when you go visit and you're ready to be more active, maybe with the warm weather the last few weeks to the last few months, let's make sure you have some good shoes on when you're going traveling and you're going to maybe do some hiking or some walking. And if you're planning on going somewhere, let's make sure you try to start increasing your activity a little bit now, so you don't just get to where you're going and then you walk too much, you do too much, and then you start having pain from overdoing it without kind of trying to prepare for that. So let's make sure that if you're traveling or you're going to start doing some more exercise or more activity, you kind of break into things slowly a little bit. And don't wear flip-flops on the beach, please. I see a lot of people that come back from vacation every year and they walked on the beach for 2 days with no shoes on or flip-flops, and then they start having a lot of problems. So just something to think about. Make sure you stretch a little bit, so don't suddenly increase your activities. Those are the kind of things that I wanted to kind of go over today, mostly footwear, especially with the pandemic, with people being around and not being nearly as active. Those are some pointers I hope that will help you this summer if you're trying to get more active, because hopefully everybody's out enjoying the nice warm weather again a little bit more, and just want you to be prepared so you don't have problems. But do make sure, once again, that if you're having problems with your feet or if you're diabetic and you notice some things over the last year, let's get in and get those taken care of so they don't turn into something worse.
All right. So Tim is pulling up questions here for us. You have a couple questions there, Brent.
Okay, excuse me, I'm gonna put my pants back
Yep,
down and
go
get my
ahead.
sandals on. I forgot my feet all wet. Here we go.
I can read it for you while you're doing that. Would therapy help? Oh, I better do it this way. Would therapy help neuropathy? I'm on meds right now. Also, right foot is turning out. Told gait is severe.
Like every answer that we give you, it depends. If you have neuropathy because you're diabetic, usually therapy, we can't help you with your neuropathy. That's because of diabetes, or maybe you've had some other medical issues. You know, if you have other problems because of the neuropathy, if you have balance problems, if you've had a fall, if you have weakness, or if there are reasons that your foot is turning out, we might be able to help you with that. So it just kind of depends what is causing the neuropathy. You should probably make sure you check with your physician if you're having numbness or if that's new, or make sure to get the neuropathy evaluated. But as far as the neuropathy goes, no, I'm sorry, we probably can't improve that.
Okay. Next question is, what does pronation mean?
Pronation means the back of your foot or your heel falls to the inside. Maybe I'll stand up and show.
There you go.
I'm going to stand up and show. I'll pull my pants back up. Right there. Okay. So pronation means the back of your feet or your heels fall to the inside like that. So the inside of your ankles are coming down towards the floor. So the back of your feet are falling to the inside like that is what pronation is. And it usually, people that pronate usually means that their arches are quite low and their feet are flat almost all the time. And people tend to have a lot of foot problems if they have a lot of pronation. And then sometimes insoles or orthotics can really be helpful for that.
Okay, Tim, I want to make sure my microphone is on because somebody asked to repeat the question. So I just want to make sure they can hear what
okay.
I'm asking. So the next one is, can you briefly discuss toenail fungus? I don't know if that's in your area of expertise, Brent.
That is not in my area of expertise. I guess I would probably, my first choice would probably be to go to a podiatrist, one of the good podiatrists we have here in town, and see what the causes are. There may be different causes, so I'm sorry, that's something that I'm not able to help you with too much.
All right. Next question. Are you familiar with other orth feet, O-R-T-H feet shoes? Are they good shoes?
I'm not familiar with that. Is that O-R-T-H?
O-R-T-H feet.
I'm not familiar with those,
It's like
no.
one word.
If you can find a place where you can go look at them in a store, that would probably be good to go look at them in a store so you can kind of, like we talked about, you can kind of get a hold of them and stretch them and push on them. It's really hard to evaluate shoes on the internet. You don't know if they fit you, how they fit your feet. I would only buy a pair of shoes on the internet after I've tried them on in a store and I know, oh yes, they fit me. I've bought these before. They're on sale. But I don't buy them if I haven't tried them on before. So I'm sorry, I haven't heard of that.
Or if you buy them on Prime and they ship free and you can return them free.
I don't have that problem. Maybe other people have that. I don't know if it's a problem, but no, I don't get shoes from Amazon.
Okay, this might be a pretty broad question here too, Brent. What is the cause of swollen feet?
That's a pretty broad question. Yeah. There's many reasons. The main thing is that medically, we want to make sure do you have a medical reason? Do you have bad veins in your legs? Do you have congestive heart failure? Do you have heart problems, circulatory problems? That's pretty broad. It probably, if it's brand new, it's probably something that you want to approach with your doctor. If it's pretty new and it's not, if it's something new for you and it hasn't happened before in the past. So there could be many reasons for that. Medication changes, lots of things could do that.
Okay.
Even in the hot weather, you go sit at a ball game or you sit outside for 3 or 4 hours. It can make your feet swell a little bit.
All right. So the person who asked the question about the shoes just wanted to clarify. It should have been ortho feet. I don't know if that makes a difference to you or not, but
no, I haven't heard of those. There's lots of different shoe brands out there anymore these days. No, I'm sorry. I'm not familiar with those.
Another question. So if you are on your feet at home, maybe doing housework, whatever you have on your feet should not have a flat sole, even if they do have a closed heel and toe.
I'd have to look at the shoe. Now, this technically, this slide is a flat sole, but it's not too bad. You know, there's a little bit of heel cup in there. There's a little bit of arch. This wouldn't be the worst thing, just a pair of slides and it's kind of flat. I've seen a lot of people that wear little flat pieces of leather and that's about all they are. It's just real flat piece of leather, no cushion, no insole, no anything. So if it's a little soft and cushioning, has a little bit of a support, it's probably okay.
All right. Another question, what about bionic shoes? Bionic.
I believe bionic shoes are a drop heel shoe, like a zero gravity shoe, I believe.
I've seen them advertised, but that's about all I know.
Yeah, I believe they're at zero gravity, but the heel is dropped way down. I'm not a runner, I don't run, so I really haven't tried these shoes. Once again, it's probably up to the person to try them out and see if they work for you.
I'm questioning whether they're a drop heel because the person asking it, I know, is supposed to be wearing not flat shoes, but having. So
okay.
my guess is maybe not. But
yeah,
I
there's.
think I've seen that they have flip flops also, and they look like. I think that they have maybe a more. Structure to them.
Yeah, the flip flops. Yeah, I've seen the flip flops. Now that you say that.
So, what can be done after plantar fasciitis?
What can be done after plantar fasciitis? Well, after, is it over with?
Oh, can be done for.
Oh, for.
Sorry. What can be done for?
First thing I tell people if they have plantar fasciitis is try to figure out what caused it. Did you do it new in a different activity? Did you change footwear? What's really good for plantar fasciitis, especially if you have pain in the morning when you wake up, what a lot of people do, is put these next to your bed in the morning. So when you get up, your feet do not hit the floor. So they go right into something like this. Wear these around the house all the time. Do some stretching. Make sure you kind of think about what's causing the problem. How did it occur? Did I do something? Ice. What tends to help people now also is there's a new over-the-counter medicine called Voltaren gel. It used to be a prescription gel. I can't prescribe people medicine. I'm not a physician, but it went over the counter. Voltaren is a gel that basically it's an anti-inflammatory medicine in a gel. So sometimes people have been using that on their feet. You rub it in 2 or 3 times a day. So that sometimes has been effective for people. It's like ibuprofen in a gel, and you can use that on the area that's bothersome if you can take that kind of medicine. So you got to make sure you can take that medicine, but you're not taking it orally, and that tends to help people on the foot too, is to try to use that gel 2 or 3 times a day. It's called Voltaren gel.
Can you spell it?
Voltaren, and I believe the generic is available right next to it in the store. So something topical seems to be helpful for people sometimes.
All right, everyone. We're trying to make do here, going back and forth between microphones, so I'm hoping you can hear me now. Thank you, Brent. You always do a great program and always very easy things for us to take from it, do and make some changes, and you answered a lot of questions as well, so thank you. Want to remind everyone of upcoming programs. Next Wednesday, June 16th at 2 p.m., we have Dr. Selden Spencer is doing a program, The Aging Brain. Prevention is the best medicine, and he always does an excellent job. Then we jump into July, and we have back-to-back programs in July. Wednesday, July 21st, 2 p.m., we have medication management with Ellen Heikens, who is one of our pharmacists here at Mary Greeley Medical Center. And then Thursday, July 22nd at 2 p.m., we have taking care of yourself while taking care of others. And Valerie Bolin, who is our home health and hospice services coordinator, is giving that program. So remember, you have to go to our mgmc.org/PTA. Along the right-hand side, there's a calendar announcing upcoming programs. Click there and you can register right on our website, and then you'll get an email with the link to sign up. So thank you for joining us, everyone. Thank you again, Brent. Have a great day and keep those feet healthy. Thank you.